The Commission on Population and Development, Caraga Region, in partnership with the Caraga State University, came up a research study entitled Knowledge, Attitude, and Practices on Responsible Parenthood and Family Planning and the Psychosocial Well-Being among the 4Ps Beneficiaries of Caraga Region.
This study focused on determining the knowledge, attitude, and practices on responsible parenthood and family planning, and the psychosocial well-being of the 4Ps beneficiaries who attended the various demand generation activities on responsible parenthood and family planning in Caraga region. Quantitative in design, the study employs a modified face-to-face interview in conducting the survey in observance of the strict implementation of the minimum health protocols due to the pandemic. This covers 659 mother respondents of the reproductive age 15 to 49 selected through convenience sampling with their corresponding sampling areas selected through random sampling. Salient features unfold that the majority of the respondents are in their prime working age, married, Cebuano, high school graduates, and embracing Christianity. They come from rural areas and nurture a nuclear family with an average monthly income of 7,267 pesos for a family of 6. This is mostly earned by one working household member through daily wage jobs. While they desire to have an average of 3 children, mostly have an average of 4 actual children with an average of 4 years age gap. On the average, they had their first pregnancy at the age of 20. Across all sampling areas, the most commonly practiced family planning method is the use of pills, followed by the use of modern natural methods and the intrauterine device, respectively. They have been using family planning methods for 5 years already. As to fertility intent, the majority wants to limit the number of children rather than for birth spacing. Interestingly, they have a positive attitude towards RPFP and family planning method, but very frequently practice the principles of RPFP and occasionally practice family planning method. This knowledge on the 4Ps beneficiaries on both modern natural and the artificial family planning method has a positive correspondence on their respective age. Contrary, only the RPFP and the natural family planning are highly correlated. Strikingly, the actual number of children and the age when they first become pregnant has negative implications on their knowledge towards natural family planning. Their intention to limit the number of children is highly attuned with their own knowledge on RPFP. In terms of their attitude, only the intention of using the artificial contraceptives is negatively correlated. Also, the more they get farther from the barangay health center, their attitude towards the RPFP tends to decrease. On the other hand, those 4Ps beneficiaries who got pregnant at a later age seldom practice the natural family planning. This study affirms with the previous studies on the effect of socio-demographic and economic aspects on the psychosocial well-being of mothers. Low economic sources and geographical location affect the fulfillment of the mothers in their social role, which in turn result in experiencing psychosocial stress. What stands out in this study is that as the desired number of children increases, the effect of the mother's psychological stress increases. Despite the disadvantage of having more children, the mother respondents still possess positive feelings and positive functioning in life. The study therefore recommends that a multidimensional, integrated, and holistic approach is necessary to address the various concerns which can contribute to an increased knowledge, attitude, and practices of the 4Ps beneficiaries towards the RPFP. Furthermore, the researchers recommend to have a more in-depth research on the low utilization of family planning method, not only for the 4Ps beneficiaries, but to the entire mothers of Caraga region or in the Philippines in general. It is also important to elicit and capture the knowledge, attitude, and practices of the spouse to provide another perspective on RPFP. In the future, this study could be a basis of other regions to conduct similar studies.